Hi everybody, I'm Namita Jain, a wellness specialist and a wellness author. I'm at Bombay Hospital in Mumbai and I am delighted to be in conversation with Dr. Varsha Patil, a leading neurologist. Doctor, the topic I would like to discuss today is migraines. You know, a lot of people suffer migraines. It comes without warning and you suddenly get into severe head pain, headaches, and it can cause a lot of stress, discomfort, also in some cases anxiety, because you don't know where you will be when you get this migraine. So the first question I would like to ask, what causes migraines?
Yeah. Dr. Namita, I think you touched the very core heart of what ladies and a lot of people suffer.
Yes.
Nobody realizes, but migraine is one of the commonest cause of headaches that people have. In my outpatient, I would say that would be the commonest complaint that people would come with, and in 10 there would be 8 people suffering from migraine. Migraine is of course not the only headache, but it's a type of headache which is very peculiar. So basically, how and when would somebody get a migraine? So as I look at it, there are some inherent risk factors. Being a lady, okay, you are more prone to migraines. It's more about the hormonal response of the body.
Would you say it's genetic?
Yes. So migraine runs in families.
Yeah.
So you would have mothers and kids both suffering from migraine, and even adolescents can suffer from migraine. And of course, in today's life, the most common cause of suffering terrible headaches is the lifestyle change.
Right. So, doctor, a lot of people, who have excessive caffeine or smoke or are out in the sun or have less water or erratic dietary habits, do you think correcting these also can help a migraine?
You touched my heart, Namita. That's really the advice that I give my patients when I say, look, I'm going to give medicines, but your lifestyle change is the most important thing to prevent your migraine, the terrible attacks that you may suffer and lose work hours. So as Namita has pointed out, these are the really important stress markers. So when I look at a patient, I said, look, first is changing your lifestyle. You need to have adequate sleep. Quit your smoking. Have proper meal hours. You can't be empty stomach. If you're going out in the sun, please wear your glaze, your scarf or your cap, whatever. The second part of my prescription becomes the medicines.
Right. So, doctor, with regards medicine, since migraines don't come with a warning, I know a lot of people suddenly traveling and they get a terrible headache, migraine, and they can't take it. Would you recommend that they carry their medicines in their wallet, their purse, their bag? What would you say?
So again, she's touched on a really important point. I'm in the middle of a meeting. I think I'm getting my headache.
Yes.
What do I do now? Do I rush to the chemist? No. So I tell my patients there's an SOS medicine that you can take. It could be a very mild painkiller, as much as just a Crocin or a Dolo. Please keep it in your purse. Becomes very handy. Of course, this is the SOS or the acute treatment. As sometimes a chronic migraine prophylaxis, we give daily medications, maybe for a month or two. And if the migraines are terrible, not getting better with 1 or 2 medicines, we've even gone and given patients injections or some sort of, therapies, including arm bands which detect and reduce the frequency of migraines.
Doctor, I think this is so useful, this entire interaction with you, and for people who have migraines and they're looking for answers. I think if they watch this video and watch you, I think they would have such a useful takeaway message. And I think lifestyle, medication, meeting a doctor on time.
Yes, of course.
Yes, and taking care of your health. Thank you so much, doctor,
Thank
for
you,
this
Namita.
interaction.
My pleasure.
Thank you.